Hi, this is Terry Kuti with Deep Sea Foundation, and I'm very honored today to have Sherry LaSalle, who is a breast cancer nurse navigator. So Sherry, as a breast cancer survivor, I know that when we are newly diagnosed, we are overwhelmed with information and just the entire diagnosis. So I think your role is very important, and I'd like you to help us understand what it is you do today to help breast cancer patients through this, journey that they have to go through.
Well, as my job as a nurse navigator, I start with the patients in the women's center and right after they've had their biopsy. And then when they get their results, I do tell them their results and I help them throughout their journey. So it starts with the cancer diagnosis, and then we sit down, we go over the pathology, we talk about a plan, and the plan will include seeing surgeons, oncologists, and radiation. And I just help them with each step through education and compassion and just helping them understand what's going on with them. Because as you know, when you hear that word cancer,
Right.
Your mind gets completely blank and you need help understanding what's going on with you.
Absolutely.
Yeah, so we start and we sit down, we go over the path, and then we talk about what are their options. And you start with mastectomy. Do I have a mastectomy with reconstruction? Do I have a lumpectomy with radiation? And those are really deeply personal subjects to the woman who's facing all of this, and we do a step-by-step and we talk about what kinds of reconstruction. And one of the topics that comes up most frequently is the deep flap, and how important having the woman who is facing the mastectomy to feel whole again and just be prepared for their journey.
I'm really glad to hear that because I don't think that all women have the opportunity at the time of diagnosis to have a discussion about reconstruction. I think that some people walk into their healthcare providers and reconstruction is never brought up. So I'm so glad that you provide that service for women. And as you said, it's a very personal decision. But they can't make a decision without, like you said, that informed, educated information.
Well, it's a shared discussion that we have so that you make the plan of care. And fortunately, in my job, I can actually physically go with them to the surgeon, to the plastic surgeon. I don't have that deeply emotional content, going
connectedness to the cancer.
Connected to the cancer, so I can ask those challenging questions to the doctor so that they're getting their answers.
And how comforting for the patient to have that second ear when you're so overwhelmed, to know that someone, like a nurse navigator is sitting there with the patient to help kind of ease that burden for them.
Oh, absolutely.
Yeah.
I mean, it's just amazing that I'm doing this and walking with people who are facing something so devastating in their life. And I'm honored being a part of their journey.
Well, I'm honored right now sitting next to you, knowing the work that you do. Thank you so much for what you do for breast cancer patients, but also for sharing your time today. Just to let everybody know, it's Friday afternoon and Sherry's spending time with us. So we really, really appreciate it.
Thank you.
All right. Thanks for being here today.